Hello, I'm Jamie Parrott, Vice President and Chief Operating Officer for MedResults Network, and I'm delighted to welcome back our very special guest speaker for today's presentation, Dr. Ben Johnson. Dr. Johnson started his career in 1997 when he opened one of the first Medi-Spa chains with locations all around the United States. He then founded and formulated his very first skincare line, Cosmetics, with a strategy that was unique at the time. Ultimately, his line produced medical strength results using natural and chirally correct ingredients, or those that provide the most benefit to the skin in terms of efficacy and absorption. Dr. Johnson is the founder and formulator of the Osmosis skincare line and OsmosisMD, with the goal of changing the direction of skincare away from excessive exfoliation and renewing the focus of dermal remodeling. We're delighted to have Dr. Johnson here with us today to speak about a topic that's becoming very popular and even critical to most practices right now. The world of aesthetics is rapidly changing, as we all know, so developing a skill set that allows skincare professionals to expand their business beyond the local community is becoming more and more critical today and into the future. As Dr. Johnson has spent 20 years researching skin conditions and has discovered new information as to their causes and the solutions, he's put together our webinar today, which will discuss all of the clues that the skin provides, including connecting specific organs to regions of the face. This will allow our attendees and the average skincare professional to diagnose a patient with just an image or through video chat. Dr. Johnson today will also teach how to keep the body and the skin healthy during these toxic times. So without further ado, I would like to introduce Dr. Ben Johnson. Thank you for being here with us today.
Such a pleasure. Thank you for having me. All right, so we will jump right into this. This is a fun lecture. I hope you approach it with an open mind, because it is really the net effect of 20 years of my own internal research. I'm not a researcher by trade, but I've had a unique perspective of not practicing for the last 20 years. And as a result of that, I focus my attention specifically on working with my clients and your patients and helping them sort of figure out things from this new perspective. Now, we come at this particular presentation at a time when our economy is, certainly it has a big question mark behind it as to when things are going to recover and how completely things will recover. And so I have been honing these skills in online analysis and support for a variety of skin conditions, including very, very severe ones. And I think you'll find this quite fascinating. So let's jump right in. Again, so you may be an esthetician working at a medical office. You may be a nurse watching this, working at a medical office, or I may actually have the physician, him or herself, watching this presentation. And I appreciate your time, and I promise you that you'll find this to be interesting at the very least. But hopefully what you'll find it to be is compelling enough. And I want to emphasize, I'm not throwing ideas out there. These are practiced ideas and strategies for online skin analysis that are working at a very high success rate. We're getting well over 90% success rate in just about every skin condition. And when you start to see the list that I'm talking about, I'm sure your jaw will drop a little bit. So the thing I've learned is that, having had Medi-Spas and knowing that keeping them busy when clearly these non-essential businesses are being shut down is quite challenging. And so what I'm here to encourage you to do is to try to set up a more proactive approach where now your estheticians and nurses, or you yourselves, if you are those people, are directly reaching out and connecting with people, existing clients, prior consultations, and or marketing in a social media campaign for new eyeballs and new support. So you're offering these services, and I think it should become more of a norm. You can't bet on the fact that everything's going to go back to normal, especially within the next 2 years. And knowing the Medi-Spa world, as I do, I know that means for a lot of you, that could pose quite a financial challenge. So we got to get people working, get people, what do I want to say, expanding their reach, and of course, generating sales, right? I mean, as you connect with these people, you're going to be limited. Obviously, you can't schedule a laser procedure or an aggressive chemical peel, but what we're proposing is there are ways to get really significant results, as you're about to see, in a format that is safe for them to do at home. So in other words, you can not only do the analysis of their skin from home, and I'm going to give you some new questions to ask from our perspective of how the skin's issues come about, and then to be able to prescribe home facial strategies where you can generate a reasonable amount of revenue. It won't quite be the same as it was in the medical office, but we think it can be really successful. We've already been implementing this around the country and really around the world with tremendous success. So let's just jump right into some of the questions I ask when I do the analysis. Obviously, you're going to be connecting with them and looking at their skin, and I'm going to get into some of the clues I use to address what the skin might be telling us. For those of you, the physicians and nurses who've had extensive medical background, a good case in point might be the butterfly rash found in lupus, right? Like if you see somebody present with a butterfly rash, one of the first, lines of questioning you may take is down that whole autoimmune. Do you have other symptoms? Are you having any issues with swelling or pain and so forth? Well, we're using a similar mentality here to tap into like I said, clues that we know. So within the social and medical history, I'm asking things about the type of skincare they're using. The main reason I want to know that is because I do come from a perspective that the skin does not need to be exfoliated in order to increase the turnover rate. My perspective is actually that the turnover rate slows from a loss of nutrients, because every year after age 25, your skin loses 1% of its blood flow, which means you're losing 1% of the food that is feeding, collagen and manufacturing, wound healing, and all the aspects of skin maintenance that you know about. So I check in on their skincare routine and products just to know, hey, I'm on a 10% alpha hydroxy acid every day. Well, I know then their barrier is compromised, and I need to take that into consideration. Or they might be on retinoic acid, again, compromised barrier. How do I react to that? I need to know, of course, if they're on Accutane or any other medications that might impact it. For me, what I've learned is that cholesterol medication, for example, the statin class, has a particularly tough effect on not only hormone production but also skin health. And so I'm asking about that. I'm looking into if they're doing any home treatments, related to LED therapy or any of those things. So obviously, I'm getting the best summary I can, and I encourage you guys to actually go to the trouble of looking up the skincare products that they say they're on, maybe even while you're talking to them, to get a sense of what ingredient decks and any potential irritants that may be contributing there. I'm also looking into meals. I've learned quite a bit about the dietary impact of the skin, and something that I did not learn in medical school was to analyze this concept of mucus formation within the digestive tract, really mucus formation throughout the body. It's in one sense sort of considered to be cell debris, sort of die-off cell debris, but in another sense, it actually impacts how the skin presents, and we're going to dive deep into that. So I like to get a sense of how much, in particular, my focus is on fried food and dairy ingestion. How much fried food and dairy ingestion, especially if we're dealing with acne cases, but certainly other foods, like if someone's just a fast food junkie, I know their microbiome is compromised, and I'm assuming that that'll result in things like a higher cholesterol and diabetes. I don't know if you know this, but the probiotic research right now is so compelling, and they literally are creating and getting rid of obesity, high cholesterol, and diabetes by altering the microbiome of mice. So crazy stuff happening, but it's important that if you're just now getting introduced to those ideas, here I am to share some of them with you from a medical perspective. I'm looking at their supplements. I found some supplements like pea protein causes jawline acne. And other supplements may encourage candida, which is an important bug that we're going to analyze here as we go forward. Obviously, I'm looking for history of prior laser treatments and or facelifts or any other thing like that. And then depending on what zone of the face is affected, and I know you're gonna think I'm crazy at some point along the way here because of the new ideas that I'll be presenting to you. But you do want to know about how much stress is going on in their life. Are they financially severely being impacted? Are they is their marriage falling apart? Are their children running around and or is bankruptcy in their picture somewhere? So for all these things, believe it or not, it's really important to get a stress level indicator there. Also with alcohol, you're going to hear me talk about how we can really describe the reason for why alcoholics oftentimes have a big red nose, and any recreational drug consumption, because that can be connected to acne in some cases. But also alcohol, the main reason for alcohol is for the rosacea connection. And then environmental exposures. We'll get there. So let's keep on moving along. So when you use this technique, it's a little easier to get right to the answers when you recognize where how the skin mapping goes. And there really is a skin mapping mechanism that you will find to be unbelievably accurate. And so I hope you take the time to give it consideration, to test it on your friends and family and see if in fact, oh my gosh, hey, yeah, that person does have redness around their nose. Let's ask if they're having digestive problems, stomach problems, basically, because this is the stomach. So let's dive right in and get to it. So I think there's two paradigms happening right now in the skincare industry, and I'll include the med spa industry in that as well. And that's the old paradigm where everything was very trauma-based and lots of heavy peeling, lots of daily exfoliation, lots of retinoic acid recommendations. I don't know if you know this, but retinoic acid, and you can go to our website, you have to get into the back pages, so you have to actually register. And once you register, I'll show you two very large, very significant retinoic acid clinical trials where they measured the papillary dermis density, and they found after a year on retinoic acid, it was an 18% thinning of the papillary dermis. But people up to, I believe, 3 or 5 years saw as much as a 31% thinning of the papillary dermis. I take this very seriously. I think it's the reason why people on retinoic acid tend to become more vascular over time. Some interesting other follow-up. The only thing that retinoic acid has ever shown to do that might be argued as anti-aging, well, two things, right? One is they actually damage the melanocytes, so they reduce melanin production, and then they damage the epidermal barrier, which causes a thickening of the epidermal barrier. This is where the fine line benefits come in, because obviously if this is thinning your dermis, it's not helping wrinkles, but it will help fine lines. And what I found fascinating is in the second study, they showed that the fine lines, or I should say the epidermal thickening went away after I think a year or 2 years. So there's no epidermal thickening with chronic use of Retin-A. There's dermal thinning. There is melanocyte poisoning, and yeah, so you can hear I'm not a fan. Not a big fan of alpha hydroxys, beta hydroxys. Like this is an old strategy to me that is based on the idea that if I burn the bejesus out of the skin's going to make more collagen. What I've learned in looking at the research, and I don't know if you've learned by watching it in front of you by performing these procedures, is that in fact the skin's net gain is zero. Like there is no net gain from, let's say, repeated TCA peels, and the negative effects can be post-inflammatory hyperpigmentation, post-inflammatory telangiectasia formation, and or scarring. Okay, so the new way, I prefer retinaldehyde. We have a liposome coated, stabilized retinaldehyde. Retinaldehyde is the only vitamin A of all the vitamin A's out there that is actually shown to be as beneficial in stimulating collagen as retinoic acid. But the difference is it's just non-wounding, non-inflammatory to the skin, and as a result of that, there is a net gain in collagen as opposed to that papillary loss I was talking about earlier. If you haven't heard about osmosis, one of the things you should know is I believe we're the only skincare line in the world that is promising permanent changes to the skin. You'll see some of that evidence here today. How do we do that? So my perspective is that your skin has infinite capacity, and the more we allow it to thrive, the better off it does. My perspective is that when you compare a 20-year-old skin to a 40-year-old skin, the difference is about 15% loss in circulation to that zone is a 15% reduction in collagen production. Overall, it's a 15% reduction in wound healing, and it's a 15% slowing of your epidermal turnover. So when you combine all those things together, you realize that one of the key components here was the vascularity, the ability for the skin to operate at a higher level. What I'm basically trying to tell you is the skin's not broken, it's just hungry. And so osmosis directly targets the missing nutrients to create permanent results by allowing the skin to heal itself. Now you'll see evidence of that coming. We also believe that we're treating the source. And this is where I think, from a medical perspective, I'm asking you to give me a little bit of leeway to describe for you the kind of results we're getting from this. Now, let's go back to medical school. So in medical school, in most cases, when we talked about the source of a skin condition, or really even the source of a disease, we looked at the physiology. In other words, we looked at the aftermath, the actual what's happening now to create these symptoms of this disease. So we're looking at what's happening in the body that creates the symptoms. What we missed was what happened in the body to initiate these physiologic changes that created the symptom. So often we go back and we look at the physiologic changes and we might say, oh, and rosacea, I see a vascular dysregulation. Okay, but was that vascular dysregulation related to a source that led to that? And where I go with this is epigenetics. So I'm a personal believer that several unidentified pathogens, some identified pathogens, and or toxins, toxins could be pesticides, could be food preservatives, could be, the things that show up in our world that can cause harm to us. And so these toxins can alter the epigenetics, right? Turn genes on and off. And that's what leads to disease in most cases. It's the epigenetic activation happens from something. So in medicine, we learned the body just does it. We don't know, right? The body just, all of a sudden, autoimmunity, it's probably in your genes, but we don't know. Maybe it's familial, maybe it's not. But what I'm here to tell you is, no, we're now getting such a clear picture that epigenetics are the player in all of this. So now we got to go to, well, what is turning the genes on and off? And my experience is pathogens, toxins, and I'm going to throw another one at you that's going to shock you a little bit, emotions, right? And that shouldn't shock you too much. Like we know emotions create physiologic changes. So hopefully you can follow that along. So I do have a skin mapping tool. This is the product of 20 years of analysis. And again, a lot of you, if you're physicians, you've been practicing, you just see patients every day, you're not necessarily getting the benefit of staring at skin pictures all day long and then analyzing the medical history. And that's sort of how I got to this place. So yes, and you can go and say, oh, Chinese medicine, which I know generally physicians are like, oh, that's not real medicine, but 5,000 years of a culture living on it tells you that they've had clearly some success with it. And in that, they also map the skin. And so you'll see here when we look at these images, and I'm going to go ahead and zoom this in because I had a little font. Actually, I have a virus, I think, so I'm in my files. So I have to actually use this downloaded version of the presentation, which, by the way, it can be made available too if you need it. So when we look at this, you can see large intestines up here and they come around, small intestines here. This is the esophagus. Remember I told you your rosacea is a tell, you can kind of tell an alcoholic Well, not so fast. The same picture that shows up with an alcoholic, which is a red nose, because this is the esophagus. So what it means is they're kicking back very caustic, very harsh alcohol. Usually the red nose guys are drinking the whiskeys or the vodkas or the gins. And so that hits the back of the throat, causes damage to the back of the throat, and that shows up on your nose. Now, that also happens with acid reflux, which is what the sides of the nose show acid reflux. Now, you'll see the rings here around the nose of this picture, and that woman, that ring underneath her nose, that's the stomach. So I identify H. pylori infections by the redness in the ring underneath the nostrils. I identify acid reflux by redness and capillaries on the sides of the nose. I identify a host of other skin conditions looking at the rest of the digestive map, but I'm going to summarize a few key things for you in this map. Let me zoom out one more time. Sorry. There we go. Don't want to make you dizzy. Okay. So if you can just put this together, and there is an anatomic correlation, right? It goes from the back of the throat to the rest of the esophagus, to the stomach, to the small intestine, to the large intestine. This is also your rectum around your mouth, so there's a mirroring. So when you see perioral dermatitis, number one cause of perioral dermatitis is constipation. Now, you'd say, show me your proof. Where are the published clinical trials? And all I can tell you is at this point in my career, I'm not going to get published. I am going for results, and we are killing it with perioral dermatitis. So if at any point along the way you're like, whoa, that's interesting theory, Dr. Johnson, where's your proof? I say, give me one client. Give me one client with perioral dermatitis. Let me fix their constipation. Let me fix their irritation on their skin. And there is the beginning of proof for you, right? I mean, anecdotally, there's so much we have to go on anecdotally because it's too, they've made the burden on creating prescription medication so high that just bear with me that there can be medical therapeutic levels or I should say medically therapeutic levels of supplementation, and that's what we're working on. All right, let's keep on moving. So here is a condition, acne. In this case, this woman has acne rosacea, and I want to zoom in on there so you can see what we were able to do with her. No antibiotics, no steroids, no caustic harsh chemicals. What we did in this case is we treated this woman's candidiasis. This is a candidiasis picture by what I've learned, and what you're seeing is that she's got excessive candida growth in her esophagus and in her small intestine primarily, although there's a little bit of candida growth in her large intestine. But you can see how quickly it can be resolved. So you can imagine when you're doing an online analysis of someone like this and you follow this pathway, normally you'd look at this person and say, okay, ma'am, I'm going to prescribe you an antibiotic. But as you know, those topical antibiotics for rosacea, not the best success rate. I personally believe if they work at all, they're only working not because of a mite, by the way, but because they're suppressing the skin. They work in the same way that a steroid injected into an acne lesion works. It suppresses the inflammatory component. It's not killing a bug. So that's why I treat it a different way, and you can see how much success we had. And of course, you're going to see a lot of that success as I try to expand these delicately. Apparently, my tools, my digits are not working right for me. All right, here's a great example of another case. So you're looking at this acne, you're going, okay, how do I analyze this, Dr. Johnson? Well, remember that map. This is a huge amount of large intestine candida. And you'd say, well, what's the difference between grade 1, grade 2 acne versus something as severe as this? And my answer is the amount of candida determines whether or not acne is cystic. And, we did a clinical trial, by the way, double-blind, placebo-controlled clinical trial on acne. It got a 66% improvement in acne in 30 days, just using an internal supplement, Here's another great case. So you can see she has candida of her entire digestive tract. But if you remember back to my map, the jawline is actually food preservative acne. It is hormonal because it's hormonal food preservatives. What we call xenoestrogens come in along the jawline. I have proven this as well. I don't have a study yet out on that one, but it's fascinating. So what I give them, and literally I can show you this by, you just take a supplement we have called well, I don't know if I'm supposed to talk about my products. So we have a product that binds these food preservatives before they get to the skin, and treats it very well. This is Candida in the large intestine. Again, you say, how do you know this is Candida and not a localized infection? Well, we treated this with a wellness product, and we did not try to address the infection at all. Getting on to rosacea, you know, when you start to look at these rosacea cases, you can see the amazing work we did here in 35 days. Let's zoom in on that. Again, we look at rosacea as a digestive problem. And before you go, whoa, Dr. J, rosacea is a mite, what I'm here to tell you is, in fact, it is not a mite. That in fact, the British Journal of Dermatology back in 1932, just so you know, said that rosacea was caused by digestive problems. 1932. Now, how do we get fast forward to here? A lot of misdirection, if you ask me. I mean, look at 80% of the causes of rosacea are internal, are foods. You know, pretty big hint that it's a digestive problem. So we treated the inside and outside of this. It's a strategy. You know, we won't have time to go in here today, but you get the idea of how you can do this online evaluation. Look at this guy and go, look, your large intestine is inflamed, your small intestine inflamed, your esophagus is inflamed. What are you up to? And you try to through the history of the types of foods that they're ingesting, you can get this. Again, another acne rosacea, diffuse acne rosacea, but also you can see the food preservative acne on the sides of her chin are also part of this picture. But again, this is easy to treat, guys. If you treat the inside out, you can see how effectively we can do this. Another rosacea case. This one presented more as a diffuse redness as opposed to acne rosacea. And then you can just see the kind of changes that we can do. Now, you look at some of the lesions in her upper eyelid there. I wasn't actually sure, that hadn't been diagnosed specifically, but regardless of what it was, we can help that too. As you can see, we can treat broken capillaries on the skin. We actually have a product that makes broken capillaries disappear from the skin. And of course, we treat the wrinkles as well and treat all of that. When it comes to hyperpigmentation, again, you're looking at we have a theory. Obviously, if they just have age spots, you're going at it from one perspective. But if they have, in the bottom case, dermatosis papulosa nigra, DPN, then you can treat that. We actually have a treatment for that. I believe it's actually a localized fungal infection of the skin. And so we treat the fungal infection and generally get more than an 80% clearance in these cases. Above, this is a woman with several age spots who over a period of 50 days was able to clear all those age spots, not by using a lightener, but literally healing the wound that causes the age spot. So we have a unique perspective on that. Again, when you're mapping somebody, this makes it a lot easier to treat these problems. But I want you to look very closely at that seborrheic keratosis and the ability for us to get rid of that in 50 days. Yes, we do that too. Now, how do we do that? Well, I believe seborrheic keratoses are an infection of the skin. So I put a lot of abnormalities of the body on an infectious process. This is just straight up post-inflammatory hyperpigmentation from acne. You've got to treat the source of the acne, which in this case is a candida infection in the gut. And just so you know, the way I'm presenting this is the candida infection's in the gut, and then the toxins from the candida are absorbed by the gut, and then they're dumped out of the skin. Your skin is a detox center. Here's a case of melasma. Now, I know a lot of you are going to struggle with this concept, but bear with me when I tell you we are treating melasma from the inside out. You can see in this case, this woman had tremendous results. I believe this was in 60 days, but in most cases, I'm looking at 3 to 6 months. I believe melasma comes from liver damage. And you can say, well, boy, that's out of left field. Not really. I actually think liver spots come from liver damage. But let me tell you my melasma, how I got there. Like, I started looking at hepatitis cases who were developing melasma. I looked at liver transplant cases who were developing melasma. I looked at people with known liver injury who were developing melasma. And then I looked at the reasons why people develop melasma. 1 out of 3 people on birth control develop melasma. Many people on hormone supplements develop melasma. You can go down the list. I actually have a list of the medications I'm associating with melasma. You know, the main cause is hormones. Yes, and you get melasma in pregnancy and say, well, what's the liver damage there? Well, what's happening is women over 30 in general, although you'll have some women who are less healthy and younger who develop melasma in pregnancy. But because you're over 30 and your hormones are surging, your liver actually does get compromised in some people, and they develop melasma. Now, the good news is because it's not a poison, right? It's your own natural hormones that are involved. 2 out of 3 cases, their melasma clears within 6 months after pregnancy-induced melasma. But in a third, they don't. And that's simply because they're just not healthy enough to heal their liver. So you could say, hey, that's crazy out in left field, but I'm telling you, as you can see with these amazing results, and look at the changes to their skin texture. Look at the improvements in discoloration. We are accelerating wound healing in a very unique way. Now, aging, we'll finish off on that because we're kind of getting to time here. But I'll tell you, you know, it's a unique perspective when you're doing online video analysis of aging skin, because we come at it from a very much segmented approach. Do they or do they not need epidermal repair? That speaks to age spots, texture, and pores. So that's a very unique category for us. We have a unique treatment for those. Again, a permanent treatment and by many respects. And then, or it might be fine lines and wrinkles. Okay, that's where we're going to get into, you know, how you pick your A serum. But we also address laxity and acne scarring and different things like that. I didn't even get a chance to show you the acne scarring pictures. But if any of the customers you do analysis on online have scarring, we have the only product in the world that actually reverses acne scarring. Believe it or not, yes, there are products out there that reduce redness. We actually reduce the pitting. Pretty crazy, right? And so that's all very possible. So where do I address all this? First of all, I talk about strengthening their immune system. Obviously, during these times, strengthening the immune system with wellness makes a lot of sense. And you know, one of the wellness products I have is a patented product that was clinically tested on rheumatoid arthritis and AIDS patients, where they normalize their white cell count. So we have a powerful immune boosting ingredient that really no one else in the world has or is using. In the form of trioxylane is the name of the raw material, but it works. This is the product we're using to help repair liver. This is the product we're using to build up your viral immune boosting, viral fighting capacity, I should say. And then we also are working on increasing the blood flow, repairing oxidative damage, repairing DNA damage, and addressing the emotional stress that can be involved. So when you look at some of these images, and I want you to take a really close look at what is possible, because I know you're familiar potentially with a more aggressive laser approach, but here's what I'm telling you, this can be done with home facial kits that Osmosis offers, where we can actually make these changes happen over time. I believe this lady was 2 or 3 months. So that is one of the exciting examples of it. And now how are we doing that again? We're trying to treat the various problems. So how do we treat these problems? Problem number 1, compromised skin health. So I'm of the opinion, as you've heard me say, that you should not exfoliate every day, that actually sun sensitizes you, increases your free radical damage every day, and dehydrates your skin. Now, do you want your turnover rate up to normal and up to old? Yeah, only if your skin can handle it. If you follow my philosophy that your skin is slowing down because it's lost its nutrient supply, similar to the way your body would slow down if you didn't eat enough food that day, right? Your metabolism slows in response. Well, your skin's metabolism slows in response. So what we're talking about here is a nutrient deficiency, and you have to address that by building new blood vessels, tell you about a few of those ideas, and about expanding existing blood vessels, and then just driving in with penetration strategies like liposome delivery, as many of the goodies your skin needs to do the real work of repair. You can see the dramatic changes in this woman's face. Of course, she lost a little bit of color in the process, but pretty dramatic. Look at those lines in her forehead. Look at the depth. Obviously, she's smiling a little bit, so the nasolabial folds, it's hard to read that. But I'm telling you, those kind of dramatic changes are real and possible. Look at, in this regard, what we're talking about here, and the amount of texture change And that wasn't done by resurfacing. Now, I think most dermatologists and plastics would look at this and go, oh yeah, you must have done erbium or, you know, some sort of resurfacing procedure to get that. No, no. Facial infusions using a vitamin A peel that you can ship to your client's house. You can help them walk through the process of applying it and get some really remarkable results. The liposome we use actually enhances penetration by 600%. And I do believe that one of the biggest challenges one of the biggest challenges we have getting successful results is penetration of ingredients. So it's a big focus for our range. Holistic targets, including the skin circulation. So how do we do this? Well, so chlorella, I know you're like, chlorella? Chlorella is clinically proven to increase new blood vessel formation. And it also is protective against UVA, UVB damage, and it also stimulates collagen and elastin. Chlorella is actually an incredible ingredient for the skin, and I use it in 4 times the recommended dose because I love the ingredient so much. In fact, you may see sometimes our serum when you first start using it looks a little green. That is the chlorella. We're dilating blood vessels with niacinamide. We don't dilate them to the point where people flush, but dilate them enough so that skin food improves, and that's how we address this. And you can see the changes this woman saw in her results. Also, all these images are available on our website. The DNA damage piece is fascinating for me. We actually have a clinical trial showing that we reversed AKs. The clinical trial didn't do 100% because we only used one of the 2 products we recommend for that, but we are reversing actinic keratosis damage. As far as I know, we are the only product that's non-prescription that does that, and I'm not even sure if the prescription products do it in a way I would say is progressing the wound healing process. But yes, we also have evidence of the same product tightening eyelids by 15%. I don't know of another product that does that. 110% increase in elasticity in the skin in the clinical trial that we did with this same product. And so you can just see there's a lot of that. Now, this is also the same product that does our acne scarring remodeling. And we see 30 to 50% improvement in acne scarring in everybody that uses this DNA repair serum. So it's quite unique, patented product. You can see some of the results we're having here. And then this final one is the oxidation repair. It's the trioxylane ingredient I was talking to you about and what we're designed here to do. And you can see the dramatic improvement in this woman's texture and just the healing of lesions and correction of oily T-zone and clearance of acne and all the things that we did for her. And that, a big focus was on the texture and changing the skin at that level. Now, what I've learned in the use of trioxylane on the skin is not only does it permanently improve texture, it permanently eliminates an age spot so that if you use it long enough, the age spot won't come back when you go back on vacation. Now, that's unheard of in our industry where all we ever do is use lighteners. So it's a really exciting thing to add to a lightener if you want to do that or to use on its own. So finally, I'll tell you, we're at a time of new change. We're at a time of new experiences, looking at the life through a different lens. You want to make your skin clinic successful. I think you need to focus on having all options on the table. And you can't send home an acid peel to somebody. There's way too much risk in that. So we look for sending home medically or how should I say, physiologically activating, collagen stimulating facials that do not burn them in any way, so there's no risk and it's safe to do. And you can do this as an esthetician, a nurse, or a physician in your direct video consults with people. So I've given you a lot of information today. Clearly you can email me at drben@osmosisbeauty.com or check out our site for any more information. We'd be happy to help you in this process of further training. And even if you don't implement this completely, maybe some of the cases or some of the directions that we went with these skin conditions will entice you into at least examining the possibilities, because I'm here to tell you, after 20 years of analyzing this, I am 100% confident that this is the way the textbooks will be written in 10 years. This will describe acne as a toxin purge. It will describe rosacea as a digestive problem, melasma as a liver problem. We have the results to prove that to you. So I hope this was helpful. And at that, I will finish. Thanks so much.
Dr. Johnson, thank you so much for your time today. I have a question that I think viewers would probably want to know as well, and that is, if a clinician wanted to incorporate facial mapping to start addressing and treating skin conditions in their practice, how would they begin if they wanted to start doing these online consultations which incorporated your facial mapping or something to that effect?
In most cases, unless they're intrigued themselves and want to chase this down, they're going to be sending their staff. We have tons of online education and a sales team to assist in guiding them through the process. I've got hours of content of me passionately going through these things. Yeah, I think it's not too hard to just get dip your toes in the water and get a feel for it. Get more comfortable with the types of supplements that are needed to help this. And they're perfectly capable. Like, I've identified Candida as one of the sources of this. Certainly a prescription diflucan is an option there. But we think we actually can even do it better with less side effects through supplementation. And that's a revenue stream, by the way. Selling supplements is also a revenue stream that needs to be considered for a lot of docs who haven't quite jumped into that realm. And I think they'll find it's a fun and exciting place to get some more expertise.
Awesome. Well, thank you again for your time. We appreciate you putting on this presentation today for everyone. And as Dr. Johnson mentioned, please feel free to reach out to him directly, or of course, you can always defer to us here at MedResults if you have questions or would like to be connected. So thank you again to our listeners, and thank you, Dr. Johnson, for the wealth of information today. We appreciate it, and we'll see you on the next one. Thanks.
The next one.
Bye.